Welcome to the UB Medicine podcast. I'm Dr. Allison Brashear, the Dean of the Jacobs School of Medicine and Biomedical Sciences at the University at Buffalo. Today, we're diving into a topic that's close to our hearts and critical to our community, primary care. Across Buffalo, we're seeing urgent needs in primary care, especially in underserved neighborhoods. But we're also seeing bold solutions. In this episode, we'll explore how the Jacobs School is responding through innovative educational models, strategic policy leadership, and deep community engagement. I'm joined today by two incredible leaders. Dr. David Milling, our Senior Associate Dean for Student and Academic Affairs, and Dr. Nancy Nielsen. Nancy, welcome. Let's talk about the broader landscape. What are some of the most pressing issues facing primary care in Buffalo, and what does the data tell us?
Well, first of all, the biggest problem is the sheer number of clinicians who are doing primary care. And what happens is that makes a real access issue. Patients who need a primary care physician are having a hard time finding one who's taking new patients. And many of the primary care physicians in our region are aging out and are probably going to retire from practice before long. So the first issue is access.
So we always say in Buffalo, everybody needs a quarterback. What does a primary care physician do?
Boy, that is the key question. And it is really hard to be a primary care physician. You have to be able to handle a lot of complex things. You have to be smart. You have to be nimble, and you have to deeply care about your patients and know them. That's critical. And I think that's not really been valued in the way it should be. But we understand that, and we are trying to change that narrative about primary care.
So we're changing the narrative. So we've been working on something called the Buffalo Primary Care Initiative, and it's really gaining momentum. And what makes this especially important? Because we want students to go into primary care.
We do. So we've identified the need. We have a vision for what to do about it, and we have a real plan to implement the solution. That's the key for the Primary Care Initiative.
So the Buffalo Primary Care Initiative is really about having students come in and say in the beginning they want to do primary care and they're committed, and then we will move them out through a proposed program in 3 years, and then they will do a residency and have a job with UB. And by that way, I think we think that we'll be able to make sure that everybody has a quarterback.
Absolutely. So we're doing it faster than we've ever done medical school before. So it's a plan to implement this quickly. It also is the educational framework that we're going to give them. The whole push now nationally, as well as regionally, is toward value-based care. We're going to help them understand what that means, how to function well in that environment in a way that treats patients the best possible way and also is fulfilling to the clinician who's providing that care.
Can you share a little bit about the national landscape and how we need more primary care, both in Buffalo, but also in rural communities, because I think that's something that people don't always know.
You're absolutely right. The need in urban areas, just like in Buffalo, I mean, we know certain zip codes that really are terribly underserved in Buffalo. But if you go to outlying counties, there's a tremendous need in rural areas, and that's true nationally. So this has been an issue that's been recognized for many years. At one time, it was thought nurse practitioners would fill that need, but it turns out that they go the same places that physicians go to practice because there is a needed infrastructure to do this right. And that infrastructure has to be available. The old Marcus Welby days are a vision of the past. Now with technology, we need an infrastructure, we need a staff, we need to do this right in order to get the miracles of modern medicine delivered to our patients.
So we've talked a little bit about the value-based payments, and then we talked about the fact that everybody needs a quarterback. Can you tie those two together? Because that's one of the ways we're going to bend the cost curve. And one of the things that I think is near and dear to your heart and mine is to lower the cost of healthcare while providing excellent healthcare and access to care when you need it, where you need it.
That's a great question. And for decades, it's been clear at the national level as well as locally and in the states that this is an issue. And value-based care, all of the formats for delivering value-based care, and by the way, in the heightened political situation that we find ourselves, this value-based care has been embraced by both parties enthusiastically. So this is not one where one side or the other is right and the other is wrong. They both embrace this. And in all of the models, the key to success is the quarterback, is the primary care clinician who knows the patients, listens, understands the nuances, understands their social needs too, because that certainly enters into it, and is able to send them to the appropriate place for care. So value-based care depends on the key workings of a primary care clinician.
And that primary care clinician is somebody who's going to make sure that you get the mammograms and the vaccinations and the colonoscopies and make sure that people, get their blood pressure checked and stuff. All those things that are designed to prevent chronic illness.
Absolutely, because when preventive measures are not used and when monitoring, for example, blood pressure, for example, or your glucose, are you pre-diabetic? If you don't have somebody check, you will never know. And we can fix all of those things. But if people don't access the care, either because, as we used to have in our country, 19% of our population without insurance, it's now better. It's down to somewhere between 7 and 8%, but it's about to change. And that's a real problem. The more people who are uninsured, the less people are going to access preventive care.
Well, we're here to change that with the Buffalo Primary Care Initiative. And, the proposal is that we will train students who are committed to primary care, provide them scholarships, residency, and then they will work here in Buffalo. And I think that's really so important because it creates a legacy that we will be able to continue year over year to continue to improve the health. I just have one question as we wrap up. I'd love to hear from both you and David. What is one key takeaway that you hope our listeners will leave about the future of healthcare in Western New York?
I would say, and I'm speaking now to people who might be considering a career in primary care, the most rewarding part of medicine is spending time with patients and helping them navigate life, and also making sure that the diagnoses are correct, that they're sent to the right place, that they get the care that's going to help enhance their lives and in some cases save their lives. And as an academic institution that does research, we are dedicated to bringing the latest in research and changes in medicine in ways that will help patients. This primary care initiative is accelerating that, is doubling down on it. And I would just add one last thing. In the New England Journal of Medicine journal called Catalyst, there was a very interesting collaboration. It described the University of Minnesota and United Healthcare coming together to teach medical students a course in value-based care. At this point, there are no enemies in this. We are all in this together. We will collaborate with anybody in industry, in business, anybody who will help us solve the primary care shortage.
Well, it's an excellent point. And I think the piece here is that it's really about collaboration. collaboration with our hospitals, collaborations with our communities, with our insurers, because we've got to figure out how to do healthcare differently, right? And the Buffalo Primary Care Initiative is really how we can do healthcare differently in Western New York, and be a model for the country. I'm joined today by Dr. David Milling. David, thank you for being here. Let's start with the big picture. Why is it so critical to invest training more primary care physicians, and especially in a community like Buffalo? We need many, many more primary care like you.
That really is the crux of the matter here. We are a population that has lots of chronic disease. And as we think about that, we have a lot of patients, mainly on the underserved east and west side of Buffalo, that have no primary care physicians. And that dearth of primary care physicians is imperative on us to be able to fill that need and to focus on getting more individuals to care for our population.
So we've talked a little bit about how everyone needs a quarterback. You have been leading the initiative to develop a proposed 3-year new curriculum. So instead of getting out of medical school in 4 years, it's 3 years. And can you just elaborate a little bit about how this model balances the quality, but also the need to get people to be doctors sooner and to meet the needs of our community?
I think that is really such a good question, because most individuals, when they hear about us changing a program from 4 years to 3 years, the initial thought might be, well, how are we going to train these individuals and have the quality individuals with a decrease in terms of training? I think it's so important for us to make the point and to reassure people that that actually is not the case. With such a focus on primary care, we can, in fact, train these individuals in a much more focused manner to be able to provide the necessary tools that they will need to meet this incredible need that we have in our community. It will mean that we will make some changes to the sequence and cadence of how students are trained, but it's not going to impact the quality or the knowledge that they gain over that period of time.
So we could talk a little bit about how we're going to connect that to Buffalo, but there is a consortium that's been doing this for a while. So I think there's 25 schools that are part of that consortium. So the groundwork has been laid. So what we're doing is bringing that important initiative here to Buffalo.
Yeah, I think that, again, another important point. This is no longer an experiment, right? We now have a lot of data as to the fact that this actually works, and it works well. And it is such an important thing for us to do, again, to meet that incredible need that we have in our community that needs to be filled.
The Buffalo Primary Care Initiative is about developing this proposed program, and then we're also hoping to raise scholarship money for those students and then have them have a residency here in Buffalo and then stay and work for UB. That really makes sure that we're training people who are going to have an impact directly in our community, particularly our east and west sides. I know you work at ECMC. How does that speak to kind of your heart as a primary care physician that we're laying this groundwork for that?
Well, Dr. Brashear, that when you start to make it personal, it always brings out a different side of me, because this is what I've dedicated my professional career to as a clinician, in terms of making sure that we're caring for underserved individuals. I happen to do this at ECMC, which is one of our amazing institutions here in town that helps to provide a safety net for so many of our individuals on the east side of Buffalo. This is hugely important to me personally. I think that when you think of this pipeline that we're trying to develop from students to residents with our clinical partners, which are, again, all vested in making sure that we do the right thing. And then to keep these individuals in Buffalo to care for our most vulnerable parts of our population, I think that individuals in our population, I think that this is a game changer for us. This will help us to better show what we've spoken about for so long, that we really are dedicated and vested in making sure that our population becomes healthier over time. And this program is going to be so important in making sure that we reach those goals.
I think the 3-year pathway and making sure that we have primary care will help us get ahead of the curve, treating hypertension and diabetes and making sure that we're preventing strokes and heart attacks and that we're identifying cancers early. Those things will all be really important in keeping our community healthy, but also, frankly, bending the cost curve, because having a robust primary care program and making sure that everybody in Buffalo has a quarterback means that we will hopefully prevent some of the more expensive and more invasive care. As we think about the mission of the Jacobs School, which is to transform the health of Western New York and potentially our country using this as a model, can you speak a little bit about how we're doing work in our new curriculum to train the next generation of doctors to not only be primary care physicians, but maybe a few of them can be a neurologist?
We will allow that to happen. For I really do believe that as much as we've focused our conversation here on this program and providing primary care, which again is going to be so important for our community, the new curriculum, which is now in its second year, is so different and is so important in providing our students that information about what it is like to work in the hospital system from a health sciences perspective, what it is like to connect with the community from this amazing program that we have, which is called Community Connect, where our students all go out in that first 18 months and work with community-based organizations to learn about the community, bond with the community, and get integrated into the community. This is a part of what we want to do in addition to the clinical and preclinical education that we provide, to make sure that our students are so well prepared. And we want them not only in primary care to stay in Buffalo, but also to stay in Buffalo in any of our other specialties. As many of our students that can stay in Buffalo, we want them here. We need them here to be a part of our community to help to reach these goals.
And I know you and so many of our leaders at the Jacobs School are really dedicated to career advising, because we want students to see that they have a place here. And we really want to make sure that our students are grounded in Buffalo and hopefully see their future home, right? Absolutely. We know that if you're a medical student and a resident, you're more likely to stay in the community. And that is really good for the community because it makes our community healthier. And then, if you think about that from a business perspective, it's going to drive more businesses to stay here because healthcare is a real big economic development engine. What is one of the things that you think is a takeaway from our conversation? What do you want our listeners to know about this important work?
So, Dr. Brashear, I just want to go back to one of the things that you just said a while ago about making our students want to stay here. As someone who has been in Buffalo for over 40 years, Buffalo is a gem. And we need to be able to share that with other individuals as they come here and train here to see what an amazing place this is. And so that, I think, is so important. But to answer your question about one of the takeaways from this, it really is so important for us to realize that as we started this conversation, our mission is to improve the health of our community in Western New York, and in so doing, New York State and the rest of the world, right? So that we need to continue to come back to as our goal. And this program and initiative in particular is one of those explicit ways in which we're going to be able to do that.
Thank you for sharing your insights and your passion. The Buffalo Primary Care Initiative is more than a program. It's a promise to our community. At the Jacobs School, we're proud to be part of the solution, and we're grateful to everyone who's working to make healthcare more equitable, accessible, and community-driven. Thank you for listening to the UB Medicine podcast. Until next time, be healthy.